Yay! I'm so excited. So how many of you guys have worked with the Aerolase before? Okay, amazing. How many of you guys have a device? Okay, awesome. Perfect. Okay, I'm excited. This was actually my first big girl purchase for my business. And I'd always said for years that I didn't need a laser. I could do everything I needed to do with my hands and products and treatments, until I got to a point where I was referring clients out of my office for broken capillary treatments, skin tag removals, and also kind of getting stuck with some acne clients and some rosacea clients especially. Yeah, so I was having a lot of difficulties just like really clearing my acne clients long term. I was seeing a lot of like relapses, and even with lifestyle changes and products, I wasn't able to actually get where I needed to be where acne first begins. So I always say chemical peels and things like that is kind of like cleaning up the trash around the trash can. Aerolase is actually hitting the trash can, so the actual issue, the root cause. So you can treat 36 different things on the Aerolase Neo Elite, but my favorite would have to be acne and rosacea. So I am excited for you guys to see this treatment get done. It is super easy. I was really intimidated about lasers because, there can be scary contraindications and liability. This is truly the easiest thing I've ever done. I could do it in my sleep. I could do it like after 3 martinis. It is very easy to use. So this device is going to help not only your clients, but also bring more revenue into your practice. And honestly, I truly did not think about the money aspect. I was just looking at the client need. But wow, guys, we were doing about $7,000 in clinic a day, and that's just me providing services. And now we're doing about $30,000 a day, and that is just since bringing on the Aerolase. So my treatment times, so let's say I have an hour with a client, or 30 minutes with a client, I'm making so much more in that hour, and not only making more money, but making a bigger impact because I'm treating more deep and more long-term and not just, the surface of the skin. And I love that you can pair this with anything. There's no downtime. There's really no reason other than pregnancy to not get this treatment done. So every single person that walks into your office is a candidate for this treatment. Every Fitzpatrick 1 through 6, aging skin, pigmentation, and, do you want to hear something crazy? Melasma. And do you know why? Because it has a very quick pulse duration. So we know the burning threshold of the skin is at 800, okay, around 800, 850. And with the Aerolase, we're going in at 650 microseconds. So we're getting in and out of the skin before we can negatively affect those melanocytes. So we're actually suppressing it in a positive way. So with that being said, you can treat truly anything. You're able to treat fine lines and wrinkles, acne scarring, active acne, and I love treating acne with this because it's treating it in 3 different ways. We are helping regulate sebaceous glands and sebum, we're helping reduce inflammation and redness in the skin, and we're killing bacteria deep down in the skin. So your clients are going to see long-term results of that. That's kind of why we call it the Accutane laser, because it truly is. And then also, not to mention rosacea, broken capillaries. You can treat anything. Cherry angiomas, age spots, spider veins, toe fungus. Truly, laser hair removal. The options, guys, are limitless, okay? Truly. Okay, let's look at some pictures and slides. But that's my little intro. It truly has changed my practice, and I think too, one of the things, being a solo esthetician and it just being me, it really helped me solidify myself as a med spa by having, some bigger guns in the office and things that can really pack a punch and just make a bigger difference. Okay, so the objective is to expand your aesthetics offerings beyond the norm, learn how to leverage laser technology for clinical and business success, and discover how Aerolase aligns with high demand trends in the industry. So one thing I love about the Aerolase is it is very much a holistic treatment because there's no chemicals involved all day long, and there's so many different ways to add it onto your treatments. You can do it by itself. She holds her own. You can also use it in combination with microneedling, in combination with a chemical peel, in combination with a hydrofacial or dermaplaning, and it's so quick and easy to do. It takes me about 15 minutes. So back then, 30 minutes, I'm making $200 doing a peel. Now in 15 minutes, I can make $600. And again, it's not about the money, but at the end of the day, we're not doing it for free. So, it's not charity, but, I hate talking money because I feel like it's so yucky, but it really has helped our practice build and be able to go into a new building. So I always say, it's kind of like you got to spend money to make money. And again, even that wasn't my intention, but it's what ended up happening. So the evolution of medical aesthetics, why should we expand? So the med spa industry is shifting towards combination treatments and multimodality solutions. How many of you guys have had clients say, what can we add on to this treatment today? Can we add a dermaplaning? Can we add a face mask? Can we add, a cold globe? Can we add, whatever? People want to get the most bang for their buck in the shortest amount of time, right? They want to add everything that they can. This is also helping treat the skin 360. So we know, I love that with like a chemical peel, we're working right on top of the skin. So clients see that kind of like more instant result after they peel. They feel brighter, smoother. They get that instant gratification. But with the Aerolase, we're working deeper down. So we're really, really targeting the skin inside and out. So any combination therapy or hydrofacial, whatever you're using, you're not only just treating, the top of the skin, you're also working for long-term correction. So they kind of get that like, okay, I feel like I saw a difference right away, but the Aerolase is doing the back end of the work long-term. So this is full spectrum care. So from acne clearance to skin tightening and resurfacing. Again, this fits with every single one of the clients that walk in your doors, every single Fitzpatrick. For me, that's a non-negotiable for my practice. I want to be inclusive. I don't think it should be an option. I think everyone should be. I think we should be able to offer all services to all clients safely and effectively. Laser-based treatments offer higher patient retention. So one thing I was a little worried about, I was like, how are people going to feel going from spending $200 to $600? I feel like there's this expectation with lasers in general that they're more expensive. People didn't blink an eye. They like expected it to be, $600, $500. So I think when you hear the word laser, more is happening and they're getting a better result and a more long-term result. And it went over extremely well. So this is a non-invasive, pain-free treatment, which gives you higher patient conversion. It's affordable. It's compact. It is maintenance-free. You guys, I have the biggest gripe with laser companies that you buy the device and then they give you a card and you have to buy your little pulses, or you got to buy like another card when your little slot runs out. Aerolase has no consumables besides this little filter thingy, and it's like $1 or maybe 50 cents. It's nothing. Once I paid off my device, I'm making full income. I don't have to worry about them coming out with like a new, improved version every year. It's been the same, right? And for how long? 8 years? Yeah. And again, no consumables, which is unheard of. Every company wants to milk you for every penny, and Aerolase is not like that. And that's something that I just love about them, and love that it gives us that financial freedom, because it's not cheap to get a device. And then you get the device, you pay it off, and you're always chasing your tail, having to buy those, cards or pulses or whatever. Okay, so this is a 1064 laser. So this is targeting the skin deep down. So we're going as deep as we can go, targeting and stimulating collagen and elastin. 10 to 15 minute treatment. So you can get more patients in your practice, and you can do this pretty quickly and effectively. Okay, so now we're going to talk more about the Era, guys. So the Era is the sister to the Neo. This is working on top of the skin, okay? So this is an erbium laser. So this is like laser resurfacing. Think CO2 without the downtime and without the oozing and without the pain. So like we talked about, that Neo is going deep down, working like in the building blocks of our skin. The Era is working right on top. So that instant gratification, right? Clients will go through, you can change the settings depending on how much you want to treat and how deep you want to treat. But you can have them peeling or flaking, okay, for like 2 days or 4 days or 7 days, depending on how deep you go. So very versatile and very customizable. And I love this for acne scarring. I love this for fine lines and wrinkles. The under eye area, you're able to get so close up. And then also amazing for sunspots, pigmentation. So many uses, fine lines, wrinkles, all over skin rejuvenation. So there is a protocol called the reverse, which is like our top treatment, especially fall and winter. You do the Neo first. So we're building that collagen and elastin. We're working deep down. And then we do the Era on top to treat that skin that everyone sees right away, to get that glass, beautiful skin in literally a week. So it's an amazing treatment. So with this, it is highly precise, ablative resurfacing for fine lines, deep wrinkles, acne scars, sun damage, and texture concerns. You can use this on the body. And guys, this is safe for all Fitzpatricks too, 1 through 6. No issues. And you can make a shit ton of money doing it too. So a lot of people charge around $3,000 for this. It's going to take you less than 30 minutes to do. Crazy. Okay, so I kind of talked about the reverse, but here is a beautiful PowerPoint on this. So it shows you how we are going deep dermal stimulation and we're doing precision resurfacing, and combining the two is truly so wonderful, guys. It makes a 360 approach to the treatment. And when you're talking to clients, they're really understanding, okay, we're doing more than just working on the surface. We're going deep and we're seeing that instant. Okay, they're amazing. I mean, I don't know. It's hard to pick who I like more. It's like my cats. I love them both. Combination therapies that I love doing microneedling with the Era, the ablative laser. Amazing, amazing, amazing for deep acne scars. Okay, why is it so successful? Well, one, everyone knows about it now. It's one of those things patients are asking for. And two, again, you're getting those amazing results. No downtime. That's unheard of, guys. When people hear laser, they think pain, they think downtime, and they think really, really expensive. It's not that expensive, the Neo, to charge for, right? Like $600. There's peels that people charge for that much, okay, or really high-end LA facial. So we are getting really good results with this and not compromising the top of the skin so that they can go wear makeup that night, they can go out, but they're also getting such a deep procedure that's going to make long-term corrections in their skin. And again, I think this is, going to be the next, hydrofacial household name. So we already have people asking, like, who does Aerolase? Or people DMing me. People found me because of Aerolase, which is so cool. Now I get to show you guys some of my favorite photos. So this is one of my clients. This was 2 Neo Elite treatments. And then here is another. So this was right when she first came in with me, and then after 3. Pretty insane, right? No, baby, you're good. You can go right over that. Oh, yeah. Definitely.
And how much time in between you get to do each session?
2 weeks or a month, depending on budget. Yes.
Did you do any other treatments besides the Neo?
Not on this client, no. And then here was another. This was after 4. She got scratched by her cat. That wasn't me. Okay, and then we have 2 Era treatments right here. And this is one of my favorites. This was after 2 Neos. And then this was actually my first client I ever treated on the Aerolase. And this is after 2 Neos on papulopustular rosacea. And she is who I thought of when I was dying on the inside paying for this laser. I mean, it has changed her life. I could not get her clear without it. I tried everything. And then this is just after 1. And that was 3 days after. Pretty crazy. Okay, I think we're going to start a demo for you guys to be able to watch. All right, guys, so super easy to use, and it's really easy to hold. It's actually pretty comfortable, and I have really small hands. If you've ever seen people always comment on my Instagram that the bottles look so huge when I hold them because I have little baby hands, but very easy to hold. So I like to use the foot presser. It makes it a lot easier. So you just literally keep your foot down, and you can actually choose the speed. So you can either, go really slow when you're learning, or go a little bit faster, slower, in more precise areas. So you guys see those little tips on top, those lenses? So those are for more precise areas. So you can do broken capillaries, spider veins, skin tags. You can do cherry angiomas. You can treat, so many things. And I actually like to fine tune with some of the smaller lenses as well. So think about it this way. This is going to a point, right? So we're going straight energy to a point versus a column, which is with that lens she's using right now. It's more of a broad spectrum. You don't have to switch lenses. You're still going to get great results. But if you really want to fine tune some areas, or maybe it's your client's 3rd treatment and there's just some stubborn pigment or redness or acne that you want to kind of get more nitty gritty with, you totally can. This is such a good treatment, and it's not very loud either. It's not painful. It only gets like a little quick little heat if you're going over one area too many times. Well, not too many times, but a lot. Any questions so far? Yes?
What kind of overlap
I do about 50%. Yeah. Yes, ma'am. They can use retinoids, they can use benzoyl peroxide, they can do a chemical peel on top, they can do anything. Yeah. And that's why it works so good with acne clients too, because they don't have to get off of their products. Because we're not compromising the top layer of the skin at all. We're bypassing it, working deeper. Yes.
And is it one pass only?
I do about 6 passes. Okay. And I kind of split it up. Okay, so for melasma, I'm not doing 6 passes on the forehead right away. I'm doing 1 pass, and then I'm doing the cheek, and then I'm doing the chin, and then I'm doing the cheek, and I'm coming back. So I'm doing like the world, the circle, okay? With acne, I'm going 6, stacking 6, and aging as well. I'm doing 6 on the forehead right away, then moving 6 on the cheek, 6 on the chin, and 6 on the other side. So the only time I'll move and do like 1 full pass over the face and then a 2nd full pass is for pigment and melasma. Just because I don't want to bulk heat that area. Yes, ma'am. I've had some clients that will purge a bit and some that don't at all. So I think it kind of just depends, but I really don't see it much. I see purging more with chemical peels than I do with the clients that just do Aerolase. Yeah. Any other questions over here, guys? Yes.
I was gonna say, so she did it to me 4 weeks ago, and I started purging.
Yeah.
Not this bad, but I was freaking out a bit.
Yeah. Yeah.
She got the Aerolase and the body peel.
Yeah, doing a peel on top will help. We'll start that purging a little bit. Just Aerolase though, I mean, it can happen. Everyone's different, but I would say widely and overall, no. Yes, ma'am. Yeah, so I like to do a series of like 4 to 6 Aerolase Neo Elites, and then I like to have them come like every quarter just to maintain results. Yeah. How frequently do I have them come in? I do every 2 weeks or once a month, depending on budget. I would say pregnant, just because it's not tested, and then anyone that has like light sensitivity, I try to be careful with, even though, you know, we have the patches over. And then another one I would say is lupus. Yeah.